So this video looks at regulating heart rate and what mechanisms we have in place to help us control heart rate, increase it where we need it to, and obviously decrease it when we don't need it to be more elevated. Specifications specifically ask you to be able to explain the regulation of heart rate during physical activity, and in terms of this section, as I showed you with the first slide, really I think 3-2-1 is your best way of remembering these factors, the things that help control and regulate heart rate. So here we've got 3 neural, 2 intrinsic and 1 hormonal factor that help regulate heart rate. There is a fourth that I will mention, but there are 3 sort of more fundamental neural factors. So I think you'll already appreciate that if you're at rest, you only require a low volume of blood circulating around your body, so cardiac output remains quite low. And similarly, heart rate at rest is relatively low. So for an average adult, it might be about 72 beats per minute. And then we know that our body's very, very clever. And when we do moderate exercise, our heart rate will go up, which will of course increase cardiac output. And if we work maximally, our heart rate goes up even more to generate a greater volume of blood circulating around the body. So we're actually going to look at how we control that change in heart rate. And the critical system that does that is called the autonomic nervous system. And unlike your central nervous system, which you can control consciously, this is a nervous system which takes care of all those unconscious factors. Things like your heart rate, which you don't consciously tell to beat every time it needs to beat. Specifically, controlling heart rate is the cardiac control centre, and you'll find this situated in the medulla oblongata, so you can see here on the diagram, at the base of the brain. So pretty much any control centre we need to talk about, it lives in the medulla oblongata. This slide really just shows you, again, the autonomic nervous system, and it has 2 branches. It has the sympathetic branch, which pretty much takes care of things, accelerating things or providing oxygen to our body, to our muscles. So if we need to do that, the sympathetic branch will be more active. If we want to reduce oxygen going to our muscles, the parasympathetic side will take care of all that's necessary to do that. Here's a visual of the sorts of things the parasympathetic branch might do. So it slows heart rate, constricts bronchi, and so on. And here's the sympathetic side. So again, we're particularly looking at how sympathetic stimulation or nerves can accelerate heart rate. Pause the video maybe and have a look at this table a bit more closely, but this just divides the factors controlled by the sympathetic branch, the sympathetic nerves, that all contribute to increasing oxygen going to the muscles. So obviously heart rate will go up, and that's the focus of this video more than anything. The heart's contraction will be stronger, which we can mention a bit later. Certain arterioles vasodilate, so certain arterioles vasoconstrict. So basically we allow flow to our muscles and we reduce flow to our abdominal organs, and adrenaline is released. So the sympathetic system actually controls and makes these things happen. And conversely, the parasympathetic side does all these things, which is pretty much the opposite. So decreased heart rate, less powerful contraction, reduced blood going to the muscles, increased blood going to the abdominal organs, and acetylcholine, which is a heart rate inhibitor, is released. So 3-2-1, regulating heart rate. We've got 3 neural, possibly 4, I'll mention the 4th, 2 intrinsic, and 1 hormonal. So let's look at the neural factors first. And you should all know that the coordinator of the heart's contractions is the SA node, the pacemaker, and that will initiate impulses spreading through the atria and down to the ventricles. So these regulatory factors basically will influence the SA node. So firstly, we've got neural control of heart rate. So what I'll be describing is 3, in fact 4 factors here, which give feedback to the cardiac control centre in the medulla oblongata. So this is part of our autonomic nervous system. And then this centre will determine and control the influence on heart rate. So Based on the feedback, it will send an impulse down this sympathetic nerve, the accelerator nerve, to increase the firing rate of the SA node, or it will send impulses down the vagus nerve, this parasympathetic nerve, to reduce the firing of the SA node. So feedback from 3 and I'll say 4 factors go to the cardiac control center, and then either way will increase or decrease heart rate. The first one you can see here are chemoreceptors. Now these are typically found in the aortic arch, in the big blood vessels, and these monitor chemical changes in the blood. So chemo is a bit like chemicals, that might be a way you remember it. And specifically the chemicals that it will be observing and monitoring would be the acidity of the blood, so carbon dioxide levels, lactic acid levels, and hydrogen ion levels, and also oxygen, although it's more responsive to the waste products than it is to the drop in oxygen. So if we are exercising, we will obviously have an increase in carbon dioxide and lactic acid and hydrogen ions, possibly a drop in oxygen, and that information gets sent to the cardiac control center, which then basically initiates impulses to increase heart rate so that we can remove that waste product and supply fresh oxygenated blood around the body. So it's all about feedback and response. The second factor are baroreceptors. So again, receptors found in the aortic arch. And baroreceptors monitor the blood pressure changes. So you might know about a barometer, which measures air pressure. Sometimes people have it in their hall. So it's all about pressure. So these are stretch receptors. And if you've got a high volume of cardiac output circulating around the body, blood pressure will be higher. And if blood pressure is higher, actually the feedback via the cardiac center will create a drop in heart rate. So high blood pressure means that we'll try and reduce heart rate to try to bring cardiac output down and reduce that pressure. The third factor are proprioceptors. Now these monitor changes or movement in limbs, and there's 2 shown in this diagram. So there are muscle spindle apparatus, which you'd find in muscles, and these detect changes in length of the muscle and how quickly we change length of muscle. There are also some called Golgi tendon organs, which obviously monitor changes in tendon tension. And again, this feedback goes to the cardiac control center. So if we're moving and contracting and exercising, then feedback goes to the cardiac control center and we will increase heart rate. So the blood pressure one is the only one that, with an increase feedback, will decrease heart rate. The other 2 increase heart rate. They're the 3 main ones. So when I talk about 3, I talk about chemo, baro, and proprioceptors. But I'll put the 4th in anyway, just to show you. Thermoreceptors. Now, if we use our muscles during exercise, we generate a lot of heat, wasted energy as heat, and that gets carried around in the blood. And if we have an increase in temperature, these thermoreceptors will give feedback to the cardiac control center and heart rate will go up. If there's a drop in temperature, i.e. perhaps in our cool down we're gradually reducing blood temperature, then heart rate will be controlled by reducing heart rate. So those are the neural factors. These are the 2 intrinsic control factors of heart rate. So we can contribute to regulating our heart rate by internal or intrinsic factors, and intrinsic basically means directly to do with the heart. So temperature is one. The heart itself might increase in temperature but if it's working harder, we're exercising, and the impact of that increase in temperature means that the SA node will actually fire faster. So an increase in temperature means a faster firing rate of the SA node, i.e. heart rate will go up. And obviously a decrease means a decrease in heart rate. So temperature is one intrinsic factor. The second, which you may know already, is Starling's law of the heart. Now, with a high volume of blood returning to the heart, so a good venous return, we have a higher EDV, end diastolic volume. So the heart chambers get filled and filled and filled and filled with blood. And this means that they stretch, so the myocardium is stretched. And the response of the heart chambers stretching is twofold. One, in relation to heart rate, the SA node is stretched because the SA node is based in the wall of the right atrium. And if the right atrium is stretched, so is the sinoatrial node, and therefore it will fire faster. So stretching it makes it fire faster. The other impact is if we have greater filling of the heart chambers and the myocardium is stretched, its response is to contract much more powerfully, and if it contracts powerfully, more blood will be ejected, so stroke volume goes up. But in terms of heart rate, it's the stretching of the AV node that we're focusing on here. Finally, the one hormonal factor that controls heart rate or regulates heart rate, as I'm sure you know, is adrenaline. So adrenaline is released from the adrenal glands on top of the kidneys, and via the blood is transported to have an impact on the SA node, and basically it will trigger an increase in heart rate. So this cardiac dynamics equation you should be familiar with. So the fact that stroke volume and heart rate can influence cardiac output. We know stroke volume can go up by Starling's law of the heart. The bigger stretch of the chambers, the more powerful contraction. But we've just talked about ways in which heart rate can go up. So if both of these factors go up, we know that cardiac output will go up quite dramatically. And obviously this happens in reverse. If these factors go down, so does cardiac output. Here's a summary diagram showing our 3, 2, 1. Just pause the video and have a look at that. And just to finish with a couple of mark schemes to show you. So here's one asking you to describe just the neural mechanisms. So it talks about the 3 main ones, it mentions the thermo also, and how the feedback from these receptors gets sent to the cardiac control center, which then in response sends impulses via the sympathetic nerves to influence and stimulate a faster firing rate of the SA node. So that's just neural. And here's one also to show how a question might just ask you about the intrinsic control mechanisms. And we talk about venous return and Starling's law, and we talk about the temperature changes and the impact that those have on cardiac output. So overall, controlling heart rate is very much to do with 3, 2, 1, neural, intrinsic and hormonal factors.